60 Minutes Overtime.
Our story this week on 60 Minutes is about Japan, the incredible shrinking country that is losing population at an alarming rate, some of which is for reasons specific to Japan. In other ways, this is a real sort of canary in the coal mine. This is a real barometer of what a number of countries, the United States included, is going to confront in terms of demographics in the next decades and even centuries.
Like Japan and many other countries, the United States is facing a low birth rate. On Wednesday, the U.S. announced a total fertility rate of 1.6 children per woman in the U.S. That's less than a 1% increase from 2023, a year that saw an historic low, and still well below the rate of 2.1 births needed to maintain a population.
Americans are having less babies and they are delaying having baby to later on in life.
We spoke with Dr. Thoại Ngô, the chair of Columbia University's Heilbronn Department of Population and Family Health. He told us there are a few things that can explain this decline.
The big data story from the CDC data is that women under the age of 30 are having less babies. There's a society-wide shift on how people value family, work, and personal fulfillment moving forward. And I don't think people are not having family because they don't value family. I think they are trying to navigate the dynamic environment. For couples who are wanting babies, housing is extremely unaffordable. Childcare is patchy or unaffordable, and wages haven't kept up with living costs. The world of having a baby for them seems unimaginable. So I think how do we build a more supportive system to make sure that people who do want kids can have kids with dignity and with opportunity.
Well, thank you very
The
much.
Trump administration hopes to turn things around, aiming to lower IVF treatment costs and hearing proposals like expanding child tax credits and offering a baby bonus for new mothers.
And there are reports that you're considering doing something for moms across the country, giving them some type of bonus whenever they have a child. Are you considering that? Or are you
Sounds like a good idea to me.
But Columbia University's Dr. Ngô told us these incentives are unlikely to move the needle.
The global evidence is very clear. We can't buy fertility. Japan have invested so much in the last 40 years, and their fertility is still at 1.2. South Korea have invested $200 billion into boosting up fertility, and it hasn't worked. Their total fertility rate is at 0.7. What we learned from Europe and Asia is that, sure, you can invest in a supportive system, better child care, tax credit, pay leave, fair parenting, but it's not going to make a difference in your fertility rate. That's just the global data. You can't buy fertility, but what you can do is to create a supportive system for couples who want babies. And then I really think lowering the cost of IVF is great for a couple who wants to have babies. And I think we have to do it in a fair way. All couple who wants babies should have access to that.
Dr. Ngô said the U.S. could find solutions to its demographic problems through other means.
When you see decline in fertility and an aging population, you have a shrinking workforce. Not everybody gonna like it, but immigration, technology, and education can all help keep the economy dynamic. The rise of AI that will replace a lot of mundane and repetitive jobs. So it opened door for investment in training and education, in quality job and enjoyable jobs. And maybe we can also think about resource distribution, better healthcare, economic stability, and a more thriving set of policy that allow people to have a freedom of choice in terms of what kind of life they want for themselves.